If you've ever found yourself wondering how to recognize when your beloved senior cat is nearing the end of their life, this guide is for you. Cats are extraordinary creatures, known for their resilience and ability to mask pain, making it challenging for us as their caregivers to determine when something is seriously wrong. Unlike dogs or humans, cats rarely display obvious signs of discomfort. Instead, they may retreat quietly or exhibit subtle changes in behavior. In this detailed discussion, we'll explore 10 signs that your cat could be approaching the end of their life or requiring urgent veterinary care. While this is undoubtedly a difficult topic, it is one that every cat lover needs to understand to ensure their feline companions' comfort and dignity during their final days. So, find a quiet place, maybe even grab a tissue, as we delve into these heartfelt signs together. After exploring these signs, we'll also discuss compassionate steps you can take to provide your cat with the love and care they deserve during this challenging time. One of the first signs you may observe in a cat nearing the end of life is a distinct change in their scent. Healthy cats typically have a neutral, clean smell. However, when their body's internal systems begin to fail, this can result in a dramatic change in odor. Some describe this scent as sweet, foul, or even reminiscent of decay. This shift occurs because organs may be shutting down or toxins accumulating in the body. If you notice a strange smell emanating from your senior or ailing cat, don't dismiss it as merely unpleasant. It's a serious warning sign. Schedule a visit to your veterinarian promptly to understand what's happening and how you can help. Cats are known for their love of sleep, often spending a significant portion of their day napping. However, a healthy cat typically balances this with bursts of activity, especially during dawn and dusk. If your once active feline begins to sleep excessively, almost all the time, it could indicate an underlying issue. One common condition that contributes to this change is arthritis, which can cause chronic pain and make movement difficult. As cats age, arthritis is not uncommon, and while it can often be managed with proper treatment, excessive sleeping might also signal that your cat is nearing the end of their life. Either way, consulting your veterinarian is crucial to address their discomfort and determine the best course of action. Cats are renowned for their meticulous grooming routines, which keep their coats clean and silky. If you notice your cat's fur becoming matted, greasy, or unkempt, it's a significant red flag. Neglecting grooming often points to low energy levels, pain, or nausea. In older cats, this can also signal underlying illnesses or a decline in overall well-being. Painful matting of fur can lead to skin irritation and even infection, further exacerbating their discomfort. If your senior cat is no longer grooming themselves as they used to, it's essential to consult your vet to address potential health concerns. Weight loss in cats is often subtle and easy to overlook, especially in those with thick, fluffy coats. However, running your hands along your cat's body can reveal significant weight loss that isn't immediately visible. While sudden weight loss isn't always an indicator that the end is near, it's a clear sign that something is wrong. Potential causes include thyroid issues, kidney disease, or cancer, all of which require prompt veterinary attention. Keeping a close eye on your cat's weight can help catch these problems early, increasing the likelihood of effective treatment. Has your cat stopped showing interest in their meals or left food in their bowl? A sudden loss of appetite is a major red flag that should never be ignored. Older cats may stop eating for several reasons, including chronic pain, dental problems, nausea, or illnesses like cancer. Even cognitive decline, such as feline dementia, can disrupt their eating habits. If your cat's appetite diminishes, it often goes hand in hand with weight loss and warrants an immediate trip to the vet. While a loss of appetite doesn't always signify the end, it does indicate that your furry friend needs professional care. Cats have a natural instinct to hide when they're feeling unwell or vulnerable. This behavior can become more pronounced as they age or approach the end of their life. Many cat owners share heartbreaking stories of their pets disappearing in their final days, only to later discover that they had passed away in a secluded spot. If your cat starts spending more time hiding or avoiding interaction, don't dismiss it as a simple mood change. It's a strong signal that they may be experiencing discomfort or illness. Consulting your vet can help uncover the underlying cause and provide the necessary support. Healthy cats breathe in a calm, rhythmic manner. If your cat starts breathing too fast, too slow, or appears to struggle for air, it's a cause for concern. Labored or irregular breathing can be linked to severe conditions, such as respiratory infections, heart problems, or fluid buildup in the lungs. In senior cats, it may even suggest that their body is shutting down. However, it's important not to jump to conclusions. Some breathing issues are treatable, and a visit to the vet is essential to determine the exact cause and appropriate care. When a cat suddenly stops using their litter box, it's more than just an inconvenience. It's often a cry for help. Senior cats nearing the end of life may struggle with incontinence, have accidents outside the box, or even wet themselves while sleeping. These issues can result from weakened muscles, chronic conditions, or a loss of control. While this behavior can be distressing for pet owners, understanding the reasons behind it and consulting your vet can help make your cat's final days more comfortable. For cats with chronic illnesses, treatments such as medications, special diets, or fluids can greatly improve their quality of life. However, if these treatments stop being effective and your cat's condition continues to decline, it may indicate that their body is no longer responding. For instance, a cat with kidney disease might worsen despite receiving fluids and a carefully managed diet. Recognizing when treatments are no longer working is one of the hardest parts of pet ownership, but it's crucial to have a compassionate conversation with your vet about your cat's quality of life and next steps. Cats communicate their mood and well-being through their behavior. If your once energetic cat no longer shows interest in climbing, hunting, or cuddling, it's a clear sign that something is wrong. This shift in behavior can indicate chronic pain, illness, or simply the natural effects of aging. Recognizing these subtle changes is vital, as they are your cat's way of signaling that they may need extra care or that their body is starting to wind down. If you notice any of these signs in your senior cat, scheduling a vet appointment is essential. While some health issues can be treated, others may require you to make difficult decisions about their care. If your cat's condition is advanced and treatment options are limited, you may need to consider euthanasia as a compassionate option. This decision, though heartbreaking, can help prevent unnecessary suffering. To stay attuned to your cat's well-being, consider keeping a daily journal of their mood and comfort. Mark good days on a calendar to track their quality of life over time. This simple practice can provide clarity when the tough decision arises and ensure you are making choices out of love and care. Remember, you're not alone. Facing the end of your beloved cat's life is one of the hardest parts of being a pet owner. But remember, you're not alone. By recognizing these signs and taking proactive steps, you're giving your feline companion the gift of comfort, dignity, and love in their final days. Your efforts mean the world to your cat, and your bond will remain a cherished memory forever.